Hi Emily, my name is Erin and I will be presenting on a patient case related to your topic. So who is our patient? The patient is 3-month-old Jane Doe who has been vomiting and having diarrhea. Dad and baby visited a clinic yesterday and the baby was diagnosed with a stomach bug. They just said, keep her hydrated and sent them home. Dad and baby have returned to be seen again today. So what symptoms did the baby have, and what physical findings were present on examination? So the baby's soft spot, as you can see, has sunken on their head, which is why Dad was so alarmed and decided to bring him in. And he also reports, although she has been having diarrhea, that there has been a decrease in the amount of diapers that she's having. And then upon physical examination, you notice that the baby has dry mucal membranes and seems pretty tired. Based on all those symptoms, I would say that the diagnosis is dehydration. The infant is having a large amount of fluid loss related to their vomiting and their vomiting and diarrhea. And this is especially vital in babies who do not have a lot of fluid reserves. Relevant diagnostic tests. You could run a hematocrit if you were really unsure. If they have a low amount of fluid in their system, they'll have a high hematocrit just due to the concentration differences and no fluid diluting it. In addition, you could attempt to use the dehydration scale to try and determine how dehydrated the child is. It is important to note that many dehydration scales that work for adults or other populations may not work in children. Pomorska et al. In 2018 found that the WHO and Gorlick dehydration scales were ineffective at determining any degree of dehydration, and the CDS could only detect some dehydration but could not rule out dehydration and could not be used in moderate to severe cases. So treatment, obviously rehydration. Vega and Ava 2022 recommended for mild dehydration cases to oral rehydrate. Breastfed babies should continue to be breastfed. Try to avoid high sugar content for children if they're having these issues, especially if they're having diarrhea. And then for moderate dehydration, they recommend 50 ml to 100 ml of oral rehydration per kilogram of body weight. And here are my references. Thank you so much for taking a listen.